uh, wanting to get some good food. Also, Attorney Steve Seidman of Seidman, Margulis, and Fairman, LLP, 20 South Clark Street, 2 First National Plaza, Suite 700, Chicago, Illinois, 60603. Toll-free number, 888-837-3275. The office, 312-781-1977. America's Hero Group, also sponsored by She Serves, She Matters, partner and sponsor, National Women Veterans United. National Women's Veterans United, NWVU, is at 8620 South Pulaski Road and the lower level, Chicago, Illinois, 60652. The office, 872-731-2150. Website, www.nwvu.org. So that's all of our great sponsors. We love all of them. We have something very important. April is Sexual Assault Awareness and National Deaf History Month for today. And America's Heroes Group Roundtable, we are globally connected with Kaiser Health News. And we are pleased to have with us on our live line, speaking of Kaiser Health, hey, who else? JoNel.
Hello.
Hi, JoNel.
Hi there, it's JoNel Aleccia with Kaiser Health News. How are you, Chris?
Yes, good to hear you. Thank you so much.
You too.
Thank you so much for joining us. You're out there in D.C., right?
I'm one of our reporters in our D.C. office, but I'm actually based on the West Coast, so I'm out in Oregon.
Oh, okay. That's you can't get much farther away.
I know, right. That's true.
Well, the discussion, this is very interesting, and I know you're getting a lot of calls on this. Funeral homes. Families ponder death in the age of this problem we're having, which problem is an understatement. But tell us, JoNel, how is that being handled?
Sure. Mm-hmm. Well, the coronavirus, COVID-19, is very serious all across the U.S., of course. There have been more than 300,000 infections in the United States, and more than 8,200 people have died. So it's very serious. And one of the aspects of life that is being really upended with this crisis is funerals and funeral services, and on two ends, really, both in how funeral homes and mortuaries are handling the people who pass away, and then also how families are able to kind of mourn their loved ones. It's all being changed pretty dramatically in a short amount of time.
Well, it certainly is. And how is it being changed so that people feel safe? That's what you have to do.
Let's start with the funeral homes, and I've spoken to a number of them in my reporting. Okay. You know, mortuary workers and the people who handle all of that when someone passes away have to be very careful, and they are always very careful.
Right.
They deal with infectious diseases all the time. And so they have stepped up their protocols for handling bodies after people die, so that they make sure that they don't get the coronavirus from any of the people who have passed away. For instance, they're taking great care in how they remove bodies from places, hospitals, nursing homes, other places, family homes where people die. They're making sure to even put masks over the mouths of people who have died to make sure that they don't exhale any of the virus even after death when they're being moved. And they're taking all kinds of stricter disinfection protocols to keep themselves safe and to keep from spreading the virus in their homes or anywhere along the way. So that's one thing that's been happening. Some funeral homes have been watching strict protocols for embalming patients so that they know how to handle them even more with even more care than they usually do.
So this is something that they have to really be careful about, obviously. But
Right. Yeah, the coronavirus can spread. It's a respiratory illness, so it spreads through, droplets that we exhale when we cough
Sure.
or sneeze.
Sure.
But, those droplets can also fall on surfaces and be spread through touch. If you touch something that is infected with the virus and then you touch your eyes or mouth, or nose, it can be spread that way. So they have to be very, very careful about the spread of the virus in the environment.
I don't understand why, JoNel, this is just happening. You understand my question?
Why the virus is happening?
Yeah.
Or
Now, have we ever had this before?
well, no. This is a new virus.
Yeah.
It's a new pandemic virus. And the thing about viruses is that they can become transmissible in humans. They can mutate in a way, or form new viruses, actually, is the better way of saying it. And this is a new virus that developed, it appears, in an animal market in China, and then found a way to go, we think, from bats to another species of animal, where it then became transmissible to humans. And once it jumped into humans, then it started spreading from human to human, and it was like we were off to the races.
I'm not a biologist, but, and I love animals, JoNel. But,
Yeah.
But I haven't seen any new ones, Oh, look at there. We got a new form of elephant. We got a new form. You understand my question?
Viruses are tricky that way.
Yeah.
They can change, and this is something that scientists have been thinking about and worried about for quite a long time.
Okay, I didn't know that. So when we talk about virus, are we always talking about something that is negative or dangerous?
Yeah, I would say so. Viruses, the flu virus, influenza
Right.
is a scary virus. Viruses can be devastating. They cause an awful lot of illnesses.
So what happened? Where are we going at this point, JoNel?
Well, that's the $1 million question, isn't it?
Yeah.
I think, what scientists are telling us now is that one of the things that's so very important is that people stay home, shelter in place, don't go out and spread the virus, because there are a couple things about it. It looks like it can spread without people even knowing that they have it, without having any symptoms. And so even though you think you may be well, if you go out and mingle around in public, you could spread it to someone else. And even if you're not sick yourself, you could spread the virus to someone who could be made very sick by it, or even die from it. And so that's why government officials are stressing that people need to stay home to stop the spread of the virus, so that we get a chance to develop some treatments for it, and hopefully within the next year to 18 months develop a vaccine for it.
I tell you, this is the more you hear about it, the worse it sounds. JoNel.
Yeah, it's pretty scary. It's affecting. It can infect anyone, but it is especially dangerous for older people. Of course, that's where we're seeing a bunch of the deaths, so those folks have to be especially careful.
We're so pleased to have her giving us all this great information, because people need to know these things. There's no doubt about it. And
and I think the issue that we were going to talk about was about how this is affecting funerals.
Exactly.
We've had
that's what I was going to next. Yeah.
More than 8,000 people in the U.S. die from this already, so tragically. It's changing the way that families are able to mourn their loved ones. All of the VA national cemeteries remain open across the country, and they're still doing internments when people die. But the number of people that can be at a service is 10 or fewer, according to the CDC. And people have to practice social distancing, which means staying 6 feet apart at the funerals. And so it's really, as you can imagine, families aren't being able to mourn their loved ones in the way that they're used to.
That's terrible. 10 feet apart.
6 feet apart.
Oh, 6 feet apart. 6 feet apart. Well, the more you hear about it, almost the worse it gets. At a time when people really want to be close to family members of the deceased and all, they just can't do it.
That's very true. And what I've learned is that families are, in some places that are very hard hit, like New York City right now, it's taking longer than usual to get families from the hospital, to get families to the funeral homes, and then to get them released. So there's a little bit of a backup because so many people are dying in a confined area in New York City. But all across the country, families are having to do things like make arrangements online or using Skype or FaceTime because it's really not wise to go out and mingle with people. So they're having to change the way they arrange funerals. And then I talk to people who do basically live streaming, web streaming of funerals, and they say there has been so much more interest in people wanting, so if you can only have 10 or fewer people at a service, at a graveside service, or in a small chapel or small funeral home, people are wanting to do kind of webcast of their funerals. So that people can still be there and share just online.
When you think of all of the changes that have to be made, JoNel, because of this, and you with, the senior correspondent with Kaiser Health News there in Washington, I guess you get all kinds of questions. Because this is something that a lot of people never thought they'd have to be concerned about.
And that's very, very true. It really has changed everybody's daily life, hasn't it?
Exactly.
Yeah. And it looks like it's going to stay changed for quite some time. I mean, President Trump has said now until the end of April, but the scientific experts who are studying this think it could go on much longer, through May anyway, where we have to be careful, we have to stay home, we have to work from home, and basically stay apart so that we can help slow the spread of the virus, so that hospitals and our medical staff have a chance to handle the people who are the sickest.
You talk to people, of course, that are experts on this issue, and with Kaiser Health News and so forth.
Yeah.
Is there any thought? Does anybody, JoNel, even mention the fact that things may go back to where they were?
Well, it's going to be quite some time, and that's another $1 million question: is when can things go back to normal? Everybody would sure like them to, but it's really not clear right now when that will happen. The thing that the scientists say is that we can certainly, I'm sure you've heard the phrase flatten the curve. We can flatten the curve so that our hospitals aren't overwhelmed with the very sick patients by staying home and keeping our distance from each other.
And we'll wonder what normal will ever be. you know.
Yeah, that's for sure, isn't it?
Yeah. Before we let you go, tell us something we don't know.
Tell you something what?
We don't know that you think we should, my listeners.
Oh, let's see. I guess if I could, I guess what I would say to people is, you know, so we're going through this right now. We're going through this spread of the virus right now, and we could slow it, and maybe it will fall off some in the summer as the weather changes. We don't know for sure yet. But one thing is sure is that it is very likely to come back again next fall. We know that there's a possibility of a second wave, maybe even a likelihood of another wave of illness in the fall that we will have to be prepared for. Just like every year the flu starts up in October, this is a respiratory illness, and so we could face more of this in the fall. And if we prepare now and know now that things probably aren't going to be normal for a while, we can at least start thinking about it.
JoNel, is the government doing what they should be?
Well, that depends on who you ask, right?
Yeah.
You know, I know that we have federal agencies that are tasked with this, and they're all working very hard to make sure that everybody stays safe.
Well, I want to thank you. Give us a close, please.
Close, I guess I would say wash your hands, 20 seconds, you know, sing the ABCs twice while you wash your hands. The CDC recommended yesterday that people wear not masks, not like surgical masks, but bandanas when they go out to the grocery store. And what that does is if you are infected with the virus and don't know it, it can perhaps keep it from spreading to other people. So wash your hands, wear a bandana, and stay 6 feet away from everybody.
JoNel, Aleccia, thank you so much for that. You're doing a great job keeping us informed, and we really appreciate the time.
Well, thanks for having me. I'm happy to come back anytime. Thank you very much.
I'm sure we'll be asking. Okay, thank you.
All righty. Bye-bye.
Senior Correspondent at Kaiser Health News in Washington, D.C. Great job. We'll be back.